you a woman in medicine feeling overwhelmed and disconnected from the personal fulfillment that you desire? You're in the right place. Join doctors Joanne and Erin as they rewrite the rules for women in medicine. Let's begin.
Going through the motions, checking the boxes, and wondering why it still doesn't feel like enough. Does this sound familiar? In this episode, Dr. Joanne Sotelo joins me to talk about what she's seeing right now in high achieving women in medicine, why the standard advice keeps failing them, and how her Harmony method gives you a real clear path, not someday, but now. Joanne, I can't wait to dive into this topic. And I'm wondering, what are some of the things you're noticing right now in the women in medicine that you're coaching?
Thank you, Erin. And I hear so much guilt and shame with what you're saying in the fact that so many of us look great on paper, right? Like we've done all the things. And yet the life that we're living doesn't feel ours. It just feels like we're just taking care of people, showing up, doing all the things. And then we're feeling fine, but it's not fulfilling, and it's hard to understand. It's like it feels off, but it still looks okay. So we're not always urged into making a change, but then it's that little crack and a little bit more and a little bit more. And then we wait until it starts to feel overwhelming or that we feel like something bad's going to happen before we even recognize that it's not going well. And I believe that a lot of it comes back to connecting with yourself again, right? Which is why I love these frameworks and this framework that I'm going to be talking about, the Harmony method. It's helps us reconnect, realign, and then rise to where we're going. And because so many of us are kind of mid-career in medicine, and again, we might love what we're doing, but at this stage of our lives, it's not about doing more. It's really about coming back to what's important, even if it feels like it's not what we're supposed to, right? And I'm doing air quotes because we make so many decisions based on what everyone else is doing, the shoulds, that kind of doctor programming that we talk so much about. And the reminder that the woman, that version of you who got you here, which is an amazing place to be, right? Like we honor that and we can be very grateful, but might not always be the version of you that will stay aligned moving forward with the things that you want and how we are defining success and fulfillment and sense of self and just to feel good really about what we're doing. And it really requires us to go deeper. And as women in medicine, again, and Erin and I, we talk so much about this in this podcast because we do a lot. We take care of people. We have so many responsibilities, and it's emotional. And on top of that, we have so many life roles that we're doing, and we have a hard time because again, and I've said this so many times because I'm an expert at it. That's why I can say it so clearly. I am an expert box checker, right? Like I've talked about that from a vulnerable place that some years ago, if you hadn't seen my life, it looked so good in paper, right? Like I was checking off all the boxes. Doing my good girl thing, thinking that I was doing everything well, yet the marriage was not great, right? Like I wasn't as present as I wanted to be for my kids. Work was fine, right? Like I love what I do as a psychiatrist, but I don't know that I was showing up at my best. And it took that time that, like I share in this podcast where I kept on saying, I'm not happy, but I'm not unhappy. I guess I'm okay. And I was totally disconnected from myself. Like I couldn't even think of what I wanted, what was important, what would make me happy. And that's what I see so many women in medicine struggle with, because it's in the sense of shame and guilt that comes up, because they'll start sharing and then it's immediately but I shouldn't be feeling that way. Like I should just be grateful. And the understanding that we can be very grateful to where we are and honor it and still ask the right questions that will help us identify where we are in this season of our lives and where we want to go.
I just want to highlight something you said a moment ago, Joanne, that feeling of knowing what you don't want and being able to name that, complain about it, identify it pretty much immediately. And at the same time, the inability to even have any idea of what you do want. And I remember one of my first masterminds I went to, hearing that it's so much easier to name what you don't want. And yet when asked, what do you want? There's that silence and confusion. And I think it's important to point that out, that that's not uncommon. I think, especially in women in medicine who are so used to putting everyone else's needs in front of their own needs, prioritizing themselves last, and just acknowledging like it's not unique to you if our listener is really identifying with that. And yet there are definitely things that we can do to start figuring out what that is. And so, Joanne, I would love to hear from you why it's particularly important during these times and why the approach needs to be different.
And I'll share some statistics that we've talked about in here so often. Just recently, I was talking to another physician coach and someone who also talks a lot about burnout prevention and suicide prevention in physicians. And we were both talking from our hearts of, we need to do something different. It's not just help because we want to help. It's also creating the changes, the bigger changes, but then also the accountability, because we know in the details on the numbers change, but more than half of doctors have symptoms of burnout, period. And then on top of that, we can talk about higher risk of depression, anxiety, substance abuse. We cannot deny this. And when we were interviewing Todd Auden, like, his words stayed in my mind, that we talk about it from the perspective of the doctors, but then it's also the perspective of the physician, the patients, of then saying, as a patient, which we all are or will be, it's 50-50 that the doctor in front of you is not feeling well. It's disconnected, exhausted beyond resources, and maybe not showing up at their best. And a lot of us have been on that side, even if it's not the full blown burnout. And then on top of that, we know that as women, we carry more of a burden of the family, that second shift that we talk about, higher risks of all of this burnout and difficulties. And again, we cannot ignore the numbers. And like we talk so much about, right, like the system and the difficulties and all the things that have changed. And yes, we can think about it upstream of the things that we can do, but then also think about it individually. What are the things that we can do, and that there is help available, and then we heal in community and connection. And that connection doesn't need to be a big group. It could be one person that you're talking to, and being able to express the difficulties and feel that connection and empathy, even if the other person doesn't necessarily can solve all the problems. But it's so important. I think this timing of artificial intelligence is beautiful, because there's so many things that we can do, but it's also the fact that we can be more efficient and faster can also create more of a burden of then the things that we have to show up for, and how the patients are going to need us. I think a lot of the simple things will be at least answered with AI. And so then the work that we'll be doing might be harder, or that's part of what I'm experiencing too as a psychiatrist. It's like every visit seems a little bit heavier, like we're not talking about simple things, it's big events. And I cannot imagine what other people are doing and feeling, and having to keep up with all of that. And it's might be adding to that sense of disconnection as well.
Before we dive into the next question, I want to take a moment to brag on my friend and co-host, because her expertise speaks for itself. Joanne was recently on the Own It stage for the fourth year in a row, and this is one of the most powerful in person and virtual women's conferences in the world. She serves as a facilitator for the Women's Mastermind connected to this event, and she's been coaching for women in medicine for nearly a decade through one on one group programs and retreats. Joanne, you've shared with me a little bit about this harmony method you created. I would love for you to share with our listener how they can implement it and what it can do for them.
Thank you, Erin, for your kind words. And yes, I love frameworks, and we know that our brain works better when we have frameworks. So it's a good way for us to also internalize it and remember. And I love the word harmony. We in my program is called the Harmonized Healer because I think of it as like I think about it in terms of flow and music rather than just balance, because what does balance even mean? And I like to think of, even before we go to the framework, even defining the word harmony for you, and what are some of the things that you need, and what will bring you back to yourself, to what's important. And the first part of the framework is reconnect. And it starts with that awareness, like really allowing yourself to feel and recognize what's important to you in this season of your lives. Make sure that you are measuring yourself with an accurate ruler that's current, not what you used 5 years ago or 10 years ago or what other people use. It's very important. And this is unfamiliar territory for us because we learn to override our feelings, right? Like we talked about this of how it's functional to not be all in our emotions when we're in the middle of a surgery, when we're telling bad news to someone else, when we're running behind, where like we learn very well how to stay composed and keep on going. And again, check off all the boxes. And we need to remember that it's very important to come back to ourselves and ask ourselves the better questions, because it's in this awareness that we find our truth. And it's that truth, the truth of what's really important to you, where you will find and create alignment. And by alignment, I mean when things make sense, when you're not doing things that conflict with each other, and it's easier to find the time for what's important and set the boundaries and all those other good things that we talk about. And I have one simple but so powerful question that you can think of right now. And that question is, how have you been feeling? Really? And I'm going to say what I always say: don't take the word fine as an answer, because fine is that bad four letter word that starts with an F that gets us in trouble. That's okay if we're in the middle of something, but we need to always come back to ourselves. And it's been shown, and this is from psychiatric research, that just asking ourselves several times a day, how are you doing? Kind of checking in with yourself improves your mood. And it always brings more awareness. And when you know better, you do better. And it's that clarity that really gets you out of that autopilot and you start leading your life with intention. I gave so many of my favorite words in that answer because they're so powerful. So that's the first one. And I can go on and on. So I'll kind of give you the highlights. The second one, it's realigned. It's so important, again, to get our lives back to where we want it to be, in alignment with our values, our priorities, what's important, the people that you want in your life. And it means that you have to take responsibility to make the decisions that will reflect that awareness that you just tapped into, and know that you need to get back to what's important, your desires, and know that that's the way that you're going to create impact for yourself and everyone around you. And this is actually where things begin to shift, where you start feeling the movement of all this work, because this is where that awareness, right? Like awareness without action keeps you stuck. And this is the work to keep on moving forward. And again, we struggle with this part because we live with that tension that we know like there's something that needs to change, but we've built a life that depends so much on us that we feel like we can't really take the time to do anything else. So instead of choosing differently, we just manage. Or instead of stepping into that power of your what's really the core of who you are, then we just wait. And again, being in alignment requires a different level of power within you to lead your life that will create that ripple effect for those around you. So this is the important question that I want you to think of, right? And if we were doing a coaching session with this content, we would go so much deeper and then really delve a little bit deeper into the answer. So this is the question. What would it look like to fully choose yourself and live with that alignment of the core of who you are? And that this is a little bit of a bigger question. And it's okay that if your answer is, I don't know, but guess what? You really know. So this might be a good one to come back to, write down if you're not driving, and come back to like really imagine if there were no limits, if you could really step into that superpower of who you are, what would life look like? And give yourself permission to really tap into all the possibilities and the magic of your life. Because you don't need permission here. You need to make decisions that will allow you to move forward. So that's my inspiration in that second one. And then the third one is rise. And it's live it fully. Like this is where your life becomes an expression of this alignment. This is where a lot of this inner work that we talk so much in this podcast becomes visible. Because again, it at this stage it's not about knowing more. It's about really what you practice. What are your routines, the discipline? What are the constant things that you're putting in your life because they're important to you, not just checking off boxes that are important to you? And because you've had that awareness, it's easier to protect the time. It's easier to find the energy. It's easier to set the boundary and really prioritize it. Like we always say, we do what we prioritize. And this is where you start feeling the magic. So the question here, right? I'm giving you a very important prompt for each question is, what is one small action you can take starting today that will really reflect on that woman that you are becoming? Right? So we captured the awareness, then we went a little bit deeper of how it would be to step into that power. And then we'll bring it back to action. What is something that you can start doing on a regular basis? Because it's not just about the doing, it's also about how we are rewiring our brain and trusting ourselves even more. And it is through these small, consistent actions that the the truly you, I don't know how else to say beautiful, like this is what it'll reflect who you truly are, your heart, your core.
I took so many notes on that, Joanne. That was so beautifully said. And I'm thinking like our listener might be thinking, I heard this at a coaching call I had earlier this week. And my client said, these are really hard questions because we're asking our listener to answer questions about themselves, not someone else, to put the focus on themselves, not the people they care for. And that may be a really neglected area of your life. You might need to listen to this a couple times for it to really sink in. And what I heard Joanne say so beautifully to you, our listener, is let's raise your awareness so you can choose differently. That empowerment, that's one of the things we love about coaching, where when you make different choices, you will have different outcomes. And can you choose you? Can you choose you first? and prioritize yourself. And recognizing you might need to sleep on this. You might need to write these questions down and ponder them. And yet they are so worth answering. And Joanne also highlighted about clarity. When you get clarity, you get out of autopilot and you can find out who the true you really is. I've got so many great takeaways from this episode. Joanne, do you have one more golden nugget to share with our listener?
Yes, this reminder of when you reconnect, you hear yourself again. When you realign, your life begins to reflect your truth. And when you rise, your life finally starts to feel like it's yours again.
So beautifully said. And if this seems like a far-fetched possibility for you and you have no idea how any of these things could be possible, Joanne and I are both physicians and coaching experts. And if you're curious about coaching and ready to take that first step, you can click the link in the show notes. Or if you're on YouTube and you want to drop a comment on this episode, you can join a wait list for a limited number of spots for a small group session that will be led by Joanne and I. And with that, we hope you join the wait list and also stay tuned because our next episode is coming right up.
Do you want exclusive resources and the opportunity to connect with us? Then visit createmeaninginmedicine.com now, where you'll dive deeper into how you can create meaning in medicine. And if you're serious about optimizing your results, take 2 quick steps now. Connect with us on the website and tune in to the next episode.